To learn more about earning college credits with Study Hall, go to gostudyhall.com or click the link in the description. Andy loves skateboarding, and after lots of practice, he's gotten pretty good. Unfortunately, for every sick wheelie Andy's pulled off, there have been dozens of crashes that were not so sick. Once on a bad landing, Andy felt something pop in his knee and it started to swell way up. He went to the doctor, who said it was just a sprain and that his best options for treatment were rest, ice, and maybe some ibuprofen for the pain. Andy tried the ice pack first. It numbed the pain for a bit, but it still hurt. Then Andy tried the ibuprofen, and it made the pain disappear completely, like magic. Well, sort of, anyway. The magic that made Andy's pain go away doesn't require a magician in a cape and a top hat, just an expert in a white lab coat and goggles. Because the magician who created the ibuprofen that made Andy feel better is an expert in pharmacology. And if you want to become a magician who studies how different therapies and treatments ease people's pain, then a degree in pharmacology might be just for you. No cape required. Hi, I'm Vanessa Hill and welcome to Fast Guides, a study hall series that explains different college majors. In this episode, we'll be talking about pharmacology degrees and what you can look forward to studying in that major. Pharmacology is the study of how drugs or chemical substances affect living things. It's an extremely important field that's been around basically forever, since humans have always found ways to treat sicknesses and injury with chemical substances. Everything from aloe to amoxicillin. Pharmacologists target illnesses and diseases that can be treated with the right combination of drugs. Some pharmacologists are committed to curing some of humanity's biggest threats, like heart disease or cancer. Others jump into action in times of serious emergency to quickly develop a drug to combat, say, a pandemic. And others try to understand how our bodies react to other kinds of substances, like mental health treatments or skincare products. Once a pharmacologist develops a new drug or treatment, they test it to make sure it works, and to make sure they're not more dangerous than helpful. You've probably seen the lists of side effects that come along with any new medications that promise to reduce your weight, improve your heart condition, or sprout new hairs on your bald head. Usually, these range from mild things like, say, a runny nose, all the way to seriously bad things like kidney failure. Now, why you would risk kidney problems when glorious toupees are available is beyond me. But the point is, a pharmacologist's job is to determine all of those side effects. It's also the pharmacologist's job to determine if those side effects outweigh the potential benefit a drug has. But pharmacologists don't just make drugs. They study how any chemical affects living beings. That includes chemicals like caffeine, or THC, or nicotine. In order for companies to know just how much caffeine to put into their drinks without sending customers into a hyper frenzy, they need a pharmacologist. Even cosmetics and beauty brands need pharmacologists so that their products cause less gag and more glam. Like if you finally find a face wash that actually works to clear up your acne, you probably have a pharmacologist to thank. But before you try your hand at cracking the secret formula of your favorite drink or making your own tea tree oil, you'll need a degree in pharmacology. Because pharmacology is all about how chemicals affect living things, someone studying to be a pharmacologist needs to have a strong background in both chemistry and biology. So pharmacology is sometimes referred to as a bridge science. And on top of that, pharmacology has two distinct branches: pharmacodynamics and pharmacokinetics. Pharmacodynamics is what the body does to a drug. Things like absorption, metabolism, distribution, while pharmacokinetics is what a drug does to a body, like numbs pain, kills bacteria, causes that entire list of side effects. So when you start out as a pharmacology major, you can expect to take introductory classes in biology and chemistry, as well as courses in math and physics. These intro-level classes teach you the basics behind the drugs pharmacologists work with every day. Then your higher-level classes might get you to think about why pharmacology exists, who the field benefits, and what the safest and most responsible ways to practice are. This is critical because pharmacologists often deal with drugs that, while helpful, are extremely addictive. So pharmacology students can also take courses that study addiction, substance abuse, and the ethical responsibility pharmacologists have in the entire process. Along with your classes, you'll also be spending plenty of time in the lab. Labs are designed to give you real-life experience working with chemicals and documenting how they interact with life forms. At some schools, you may be able to participate in research projects with your professors or complete your own research in an area you're interested in as part of your degree requirements. These projects can help you gain a better understanding of the field and apply what you've learned in practical ways. Ultimately, if you are interested in how bodies work and love medicine or want to have a career in the medical field, pharmacology might be for you. This is especially true if, say, you want to be a medical doctor, but don't necessarily want to provide patient care. Which, by the way, is perfectly okay. There are more ways to help people than by sitting at a patient's bedside and talking them through all their treatment options. Pharmacologists are the ones behind the scenes, doing research and making decisions about the drugs that other doctors hand out. For more introverted science enthusiasts, this is great news. And yes, you do have to be both a science and a math enthusiast to make it in this field. For well over 4 years, your life will be filled with words like lethal and effective dose calculations and measurement of enzyme activity. We aren't going into the specifics of those, but just know they mean hourly doses of math and science. Which can mean there's a lot of information to remember on a lot of different topics. So even those supposedly introductory classes can be really challenging. In some cases, students interested in a pharmacology degree can't actually declare the major until they take and pass these intro-level classes. If you're struggling along the way, don't be afraid to seek out some help. It can feel lonely struggling by yourself, and often you may think you're the only one who isn't getting it. But chances are you're not alone. Find a peer group to study with, or see if your school offers tutors. Almost every professor has office hours as well. Attending those could be a great way to pick up on what you're not getting in class. In fact, it's your professor's job to fill in the gaps of what you're missing. But that comes with the requirement that you, as the student, be transparent and ask questions when things aren't clicking. And if you get partway through the major and realise that this isn't for you, that's fine. By then, you'll have been exposed to several different fields of science and math, so pivoting to, say, biology or chemistry can be seamless. All that science and lab experience will help you after graduation too. You'll have plenty of options available for a career in a research lab in a variety of industries, from cosmetics to nutrition to the biomedical industry. And you'll also have several handy soft skills that are applicable to just about any job. This includes perseverance and excellent time management skills built up from all of those hours in the lab, often working on multiple experiments at once. But you'll also have the foundation needed to pursue additional education, either in pharmacology or a variety of other fields, such as veterinary medicine or dentistry. For pharmacologists, there are several advanced degree options available: a master's, PhD, MD, or PharmD. The right degree for you depends on a few different factors. Say you really enjoyed your labs and want to continue designing experiments. You likely fit into a subfield of pharmacology called clinical pharmacology, meaning you'll work on researching, developing, and testing drugs. To get there, a master's, PhD, or MD degree is probably for you. But if you want to be out in the world dealing with people, then a focus on applied pharmacology and a PharmD might be up your alley. In this case, you could become a pharmacist, working with doctors and patients to make sure they receive the right prescriptions. MD degrees take the longest to complete, 4 years of schooling followed by a residency and fellowship, which is typically at least another 2 years. PhDs tend to be 5-year programs, while PharmD degrees are 4 years, and some master's programs take just 1 year to complete. Then, once you get one of those additional degrees, you may have to take an additional exam in order to receive a license in your particular state. This exam will test your knowledge of pharmacology, as well as laws and regulations for the field. But once you're in the field, the opportunities go on and on. You could become a pharmacist, or work in a lab as a laboratory technician. If the clinical pharmacology route seems fascinating, you could be a research coordinator or associate. Because there are so many different career paths available, there is also a wide range of salaries for pharmacologists. For instance, the US government hires many pharmacologists in offices like the Food and Drug Administration and at the National Institute of Health. Many of these positions start out at $70,000 because of the required graduate degree. Other pharmacologists work for independent laboratories. These are privately funded labs that are often on the forefront of clinical testing and innovation. Clinical pharmacologists at these independent labs can make more than $100,000 a year. Pharmacists, meanwhile, start at around $77,000, while more experienced pharmacists can earn nearly $165,000. Regardless of which path you choose, you'll be doing important work that improves people's lives. Pharmacologists are the ones who make sure we can treat that one pimple that just won't go away, and that we can enjoy a soda as an afternoon pick-me-up, and that we don't have to push through the pain of a sprained knee. They may wear lab coats instead of capes, but pharmacologists are working magic every day that makes our world a safer and healthier place. If you want to investigate more degrees before you choose a major, check out our other videos in this playlist. To find out how to earn college credit with Study Hall, go to gostudyhall.com or click on the link here or in the description. And if you want to help us out, give this video a like and comment to let us know how you chose your degree or what you wish you'd known before you started your degree. Thanks for watching.